Welcome to the deep dive.
Hmm.
We sift through the sources, the research, the data, and pull out the key insights so you don't have to. Today, we're stepping into, well, kind of a hidden world. It's full of tiny creatures, insects mostly, arthropods,
Right.
that have this huge, sometimes really devastating impact on global food production, on animal welfare. It's quite something.
It really is. It's a constant battle on pig farms, and often it goes unnoticed until, the damage is already pretty significant.
So that's our focus today.
Mm.
The impact, the multifaceted impact of these pests on pig health. We're talking everything from like annoying bites right up to transmitting some really deadly diseases.
Exactly. And our mission really is to get into the sources and pull out the facts, look at the direct effects, the diseases they carry, and importantly, the strategies, the solutions that are out there.
Yeah, we want to give you that shortcut to being properly informed on this. It's a topic that maybe flies under the radar a bit, but it's crucial. Hopefully, you'll get some aha moments of good, solid understanding without feeling buried in information.
Okay, so let's start by identifying the main players. Who are these pests? When we talk about arthropods affecting pigs, we're generally looking at 5 main groups: mosquitoes, flies, midges, ticks, and lice. Each one brings its own set of problems.
Okay, let's start with mosquitoes. We all know the buzz, the annoyance. But for pigs, the real danger isn't just the bite, is it? It's more what they transmit.
Precisely. Think of them as tiny flying needles. Species like culex and deeds, they're key vectors. And the critical thing, the thing you have to remember, is their life cycle depends entirely on standing water. No standing water, fewer mosquitoes.
And they carry things like Japanese encephalitis. That sounds serious.
It is. JEV is a big concern. It causes major reproductive problems in pigs, abortions, mummified piglets, stillbirths, and it's also a zoonotic disease, meaning it can affect humans too. So, yeah, mosquitoes are more than just a nuisance.
Definitely. Okay, what about flies? You mentioned them as being particularly dangerous vectors.
Right, flies are a huge issue. Let's take stable flies, Stomoxys calcitrans. What's really important about these is that both the males and females feed on blood.
Oh, both?
Yeah, both. They have these piercing mouth parts, inflict really painful bites, so they're irritants, and they're incredibly good mechanical vectors. They can literally pick up pathogens on their mouth parts or bodies and spread them around.
Like what kind of diseases?
Some nasty ones. Swine pox, Mycoplasma sus, which used to be called Epitherithosaurus ephesus, PCV2, PRRSV, and the really big one, African swine fever. They can potentially transmit ASF mechanically.
Wow. And where do these stable flies hang out?
They like to rest on shaded spots, walls, fences, things like that, and they only really approach the pig to feed, usually on the legs or ears where their hair's thinner, and they breed in wet, decaying organic matter. Think damp bedding, spilled feed, that kind of stuff.
Okay, so stable flies bite. What about house flies? Musca domestica. They don't bite, right? But you said they're still significant vectors?
Exactly. No biting, but don't underestimate them. Houseflies are incredibly efficient mechanical vectors. They have these spongy mouth parts and hairy bodies, perfect for picking up germs.
How many germs are we talking?
Sources say they can transmit over 100 different pathogens, including things like E. coli, salmonella, serious stuff. And they breed like crazy in manure and any decaying organic material. In warm, humid weather, their populations can just explode.
100 pathogens. Wow. Okay, are there other flies we should know about? You mentioned midges.
Yeah, midges, culicoid species, tiny things, sometimes called no-see-ums, and black flies too. These are smaller biting flies, but their bites can cause really intense itching. Yeah, and like mosquitoes, they often breed near water, think swampy areas, edges of lagoons. They're also known vectors for diseases like African swine fever and vesicular stomatitis.
Okay, so we've got things flying around biting and spreading disease. What about pests that actually live on the pigs?
Right, good point. Let's talk about the hog louse, Hematopenis sus. This one's actually kind of remarkable. It's the biggest blood-sucking louse found on any domestic animal. You can actually see it, up to maybe a 1/4 inch long.
I can see it. Okay.
Yep. And these guys are real homebodies. They are obligate parasites, meaning they spend their entire life cycle right there on the pig, egg to adult, clinging on.
So they don't hop off and live in the bedding or anything?
Nope. Stays on the pig, which means transmission is almost always direct pig-to-pig contact. They like the softer skin areas, neck folds, inside the ears, that sort of place. And they can transmit swine pox and also Mycoplasma sus.
Okay, lice. Got it. What else lives on the pig? Mites. You mentioned mange.
Yes, mites. And specifically the sarcoptic mange mite, Sarcoptes scabiei var. This microscopic critter is responsible for sarcoptic mange, which is, honestly, probably the most common and economically damaging external parasite of pigs worldwide.
Microscopic, you said.
Yep, tiny, round body, and it burrows into the pig's skin. Its whole life, 10 to 14 days, happens inside the skin layers. And that burrowing action is what causes the really, really intense itching the pruritus and often severe allergic reactions.
Sounds awful. Is that the only type of mange?
There's another one, demodectic mange, caused by Demodex phylloides, but it's much less common, generally causes little nodules in the skin, but usually without that severe itching. So economically, Sarcoptes is the big one.
Okay, so we've met the culprits. How does this direct assault actually look on the pigs? What signs would you see?
Well, right at the bite sites, you'll often see localized skin reactions. Small raised bumps, we call them papules. Sometimes larger reddish welts, those are wheals. You'll see redness, erythema, and some swelling.
And then the pigs scratch.
Oh, they scratch. That itching, the pruritus, can be agonizingly persistent. So yes, excessive scratching, rubbing against walls, feeders, anything they can find, even biting at their own skin.
And that rubbing and scratching must break the skin, right?
Exactly, and that's a critical point, self-trauma. It creates openings, little wounds in the skin's protective barrier.
Which then lets bacteria in.
Precisely. It opens the door for secondary bacterial infections. Often things like Staphylococcus or Streptococcus species jump in and make things much worse. Plus, repeated exposure to bites can trigger hypersensitivity, like an allergic reaction, leading to even more widespread itching and hives. It can become a vicious cycle.
Is there anything more severe than those secondary infections?
Absolutely. One of the most critical direct consequences is something called myiasis, or fly strike. This is really serious. It's when fly larvae maggots actually infest living tissue.
Living tissue. Ugh. How does that happen?
Female flies, often blowflies, lay their eggs on existing wounds, maybe even just on skin soiled with urine or manure. The eggs hatch really quickly, sometimes in hours, and the larvae immediately start feeding on the living flesh.
Feeding on it?
Yes, they release these powerful enzymes, proteolytic enzymes, that literally liquefy the tissue so they can consume it. It leads to these awful, large, foul-smelling wounds. The maggots produce toxins, leading to toxemia, systemic illness, high risk of massive secondary infections.
That sounds like an emergency.
It absolutely is. Myiasis is a veterinary emergency. If it's not treated quickly and aggressively, it can rapidly progress to shock, septicemia, and death. It's a major animal welfare crisis when it happens.
Beyond the physical wounds and infections, what about the pig's behavior and well-being? All that irritation must take a toll.
It definitely does. Think about it. Constant pain, constant itching. It causes significant stress, restlessness. The pigs are agitated. They can't settle. They waste energy scratching and rubbing that should be going into growth.
Does it affect their behavior in other ways?
In severe cases, yes. That extreme irritation can sometimes trigger abnormal behaviors. Things like tail biting, ear biting among pen mates. It can even lead to a loss of libido in boars, which obviously impacts breeding programs. It's a real welfare issue with tangible production consequences.
Which leads us right into the economic impact. This isn't just about uncomfortable pigs. It hits the producer's bottom line, doesn't it?
Oh, absolutely. It's a silent drain, often underestimated. All that stress, irritation, sometimes blood loss from heavy infestations, it directly reduces production efficiency.
Do you have numbers on that? Like for mange?
Yes, sarcoptic mange has been studied quite a bit economically. Severe infestations can knock down the average daily gain, the ADG, by, say, 11 to 15%. And it makes the feed conversion ratio, FCR, worse by maybe 6 to 10%.
What does that mean in practical terms?
It means pigs eat more feed to gain the same amount of weight, and it takes them longer to get to market. We're talking potentially an extra 7 to 10 days, sometimes more. That's extra feed costs, extra facility costs. It adds up fast. There was an old Australian estimate back in the 70s putting the industry loss just from mite hypersensitivity reactions at over $500,000 a year then.
Wow. And that's just mites. What about flies and lice?
They take their toll too. Research shows that having lots of house and stable flies around can reduce ADG by maybe 1, 2, even up to 2.4%, and heavy louse infestations. They also slow growth and hurt feed efficiency because of the constant irritation and, well, blood loss causing anemia.
Does it impact the final product, the carcass?
It can, yes. Skin lesions from bites, from mange, from lice. They can lead to the carcass being downgraded at the slaughterhouse. If the dermatitis is really bad, they might have to trim off affected parts or even remove the entire skin.
Remove the whole skin. That must be a big loss.
Huge. It can mean losing up to 17 kilograms of saleable weight. Plus, there are often financial penalties. In Australia, for example, that kind of downgrade could cost the producer something like $34 per pig.
You mentioned a silent drain before. Is there something producers might be missing, like a blind spot?
I think there is. It's this idea of subclinical infestations. These are infestations that aren't causing obvious dramatic skin problems, so the pigs might look okay, but they're still suffering internally.
So the damage is happening even if you can't easily see it.
Exactly. The reduced growth, the poorer feed conversion that's happening under the surface. Often the true extent of the problem only becomes clear at slaughter when you do skin checks or see the impact on carcass quality. So producers might be losing money without even realizing the full extent of it.
And then there's the cost of trying to control these pests too, right?
Oh, for sure. That's a significant line item in any farm budget. You've got the cost of the insecticides, the acaricides for mites, baits, larvicides, then the equipment to apply them, the labor involved in treatment, and crucially, manure management. Plus, vet consultations for diagnosis and setting up control plans. It's an ongoing investment.
Okay, so direct harm, economic drain. If that wasn't bad enough, we need to talk about their role as disease vectors. This really elevates the threat, doesn't it?
It absolutely does. This is where these pests go from being, a costly nuisance to a major biosecurity nightmare. They can transmit pathogens that cause catastrophic disease outbreaks at the herd level, even threatening entire industries.
Let's talk about the big one first. African swine fever, ASF.
Right. ASF is, well, arguably the most feared foreign animal disease for the global pork industry. It's highly contagious, causes this severe hemorrhagic fever in pigs, and mortality rates often approach 100%. And the devastating part, there's still no effective vaccine or treatment.
And pests play a role in spreading it.
A critical one, soft ticks, specifically from the Ornithodoros genus, are the only known biological vectors for the ASF virus. This means the virus actually replicates inside the tick.
Wow. And how long can the virus survive in a tick?
For years. Literally years. And it can be passed down through the tick's life stages, from larva to nymph to adult, and even from an infected female tick to her eggs. This makes these ticks a persistent environmental reservoir incredibly difficult to eliminate.
So ticks are the biological vectors. Any other pests involved?
Well, stable flies have been shown to be capable of mechanical transmission. They don't replicate the virus, but they can pick it up and potentially move it from an infected pig to a susceptible one. And we also have to consider wildlife reservoirs like wild boars carrying infected ticks, potentially spilling it over into domestic pig populations.
Okay, ASF is terrifying. What about Japanese encephalitis, JEV? You mentioned mosquitoes carry that.
Yes, JEV is another major viral threat, primarily spread by Culex mosquitoes. In pigs, its main impact is reproductive failure abortions, stillbirths, mummified fetuses, and these weak, trembling piglets, often called shaker piglets.
And it affects humans, too.
It does. It's a significant zoonotic disease. And we've seen it spreading to new areas recently, like its emergence in Australia, which really underscores its potential as a transboundary disease threat carried by mosquitoes.
What about swine pox? You linked that to lice earlier.
That's right. Swine pox is mainly transmitted mechanically by the hog louse. The louse feeds, creates a tiny break in the skin, and the virus gets in. It causes these characteristic circular skin lesions, usually on the belly and legs. Seeing swine pox is often a good indicator that you have a louse problem.
Are there other viruses that flies or other pests can spread?
Yeah, flies, particularly house flies and stable flies, can act as mechanical vectors for other important viruses too. Things like porcine circovirus 2, PCV2, which is linked to wasting disease, and porcine reproductive and respiratory syndrome virus, PRRSV, a huge economic burden for the industry due to its impact on breathing and reproduction. Flies just moving between tigs can potentially spread these viruses around a farm.
Okay, so viruses are a huge concern. What about bacterial diseases?
There are bacterial and rickettsial diseases too. We mentioned Mycoplasma earlier, the cause of erythrocytosis. It causes anemia, jaundice, reproductive issues in sows.
And lice and biting insects are suspected vectors.
They are suspected, yes. But here's a really crucial point for Mycoplasma. A major way it spreads within a herd is actually iatrogenic.
Iatrogenic, what does that mean?
It means it's inadvertently caused by medical examination or treatment, or in this case, common management procedures. Using the same needle on multiple pigs without changing it, or using unsterilized surgical instruments for things like tail docking or castration. That's a very efficient way to transmit this blood-borne organism from pig to pig.
Ah, okay, so it's not just the bugs, it's procedures too.
Exactly. It highlights an internal biosecurity blind spot. You can have great fences and protocols for things coming onto the farm, but if you're spreading disease internally with dirty needles or uncontrolled flies, your perimeter biosecurity doesn't help much with that.
Are there other tick-borne bacterial issues?
Yes. Ticks can transmit agents that cause diseases like anaplasmosis, ehrlichiosis, babesiosis. Again, feral pigs can act as reservoirs for these ticks and diseases, posing a risk especially for pigs raised outdoors or near wildlife habitats.
So it really reinforces that pest control isn't just about preventing bites, it's fundamental biosecurity.
Absolutely fundamental. You cannot have robust biosecurity without effective pest management. Inadequate fly control means viruses like PRRSV and PCV2 can keep circulating internally. Using contaminated needles spreads things like Mycoplasma sus. Integrated pest management, or IPM, is essential. It's non-negotiable in modern pig production.
Okay, so let's talk about fighting back. You mentioned integrated pest management, IPM. What exactly is that? It sounds like more than just spraying insecticide.
It is. Much more. IPM is a holistic approach. It's science-based. It moves away from just relying on chemicals and instead integrates different tactics, cultural, physical, biological, and then strategic chemical controls to reduce pest populations in a sustainable way. It's about thinking ecologically, really.
So where do you start with IPM? What's the foundation?
The absolute foundation, the first line of defense, is cultural and physical controls. And for flies, the single most critical element here is sanitation and manure management.
Right, dealing with where they breed.
Exactly. You have to break their life cycle. That means frequent removal of manure and soiled bedding, ideally at least twice a week in warmer weather. Proper disposal is key to thin spreading on fields so it dries quickly, or managing lagoons properly, and just keeping things clean, targeting areas where moisture collects.
And for mosquitoes?
Eliminate standing water, period. Check for containers, puddles, blocked drains, old tires, anywhere water can collect for more than a few days. Ensure good drainage around buildings. That's habitat modification.
What about physically keeping them out?
Exclusion methods are important. Installing and, crucially, maintaining fine mesh screens on windows, vents, and doorways can physically block flying insects from getting into buildings.
And what about preventing pests from coming in with new animals? Lice and mange, for instance.
That's a critical internal biosecurity step, often overlooked. You need a strict quarantine protocol for any new pigs coming onto the farm, or even animals returning from shows or other sites.
How long should quarantine be?
Minimum of 3 weeks. During that time, thoroughly inspect them for any signs of lice or mange. And here's the key. Treat them twice with an effective acaricide, usually something like ivermectin, about 10 to 14 days apart.
Why twice?
Because the first treatment kills the live mites or lice, but might not kill the eggs. The second treatment, timed just right, catches the newly hatched parasites before they can mature and lay more eggs. It breaks the life cycle. This is absolutely crucial for preventing obligate parasites like mange mites and lice from getting established in your main herd.
Okay, so sanitation, water management, screens, quarantine. What about using nature against nature? Biological controls.
Yeah, that's another layer of IPM. We can use nature's allies. For example, there are tiny parasitic wasps, they don't sting people, or pigs that lay their eggs inside fly pupa.
Killing the fly before it hatches.
Exactly. You can actually buy these wasps and release them in and around barns. They specifically target fly pupa. In pasture systems, dung beetles are fantastic allies. They bury manure quickly, which disrupts fly breeding.
Are there other biological options?
There are some fungal biopesticides available commercially, like sprays containing Beauveria bassiana. It's a naturally occurring fungus that infects and kills insects, but is safe for mammals.
So, lots of non-chemical options. But chemicals still have a place.
They do, but they need to be used strategically as part of the overall IPM plan, not as the sole solution. There are several key classes. Macrocyclic lactones, think ivermectin, dormectin. These are really the gold standard for treating mange and lice systemically, often by injection or in feed.
What else?
Pyrethroids are common. They provide rapid knockdown of adult insects, but resistance can develop quickly if you overuse them. Then there are insect growth regulators, IGRs. These are often used as feed-through largicides.
Feed-through, so pigs eat it.
Yes, it passes through the pig and into the manure where it prevents fly larvae from developing into adults. It's a proactive way to target the breeding sites. Application methods vary: sprays for process, on animal treatments like porons, dusts, sprays, injectables, and those feed-throughs.
You mentioned resistance with pyrethroids. Is that a general concern with chemical controls?
A huge concern. If you rely too heavily on just one chemical class, the pests will inevitably develop resistance, making the product less effective or even useless over time. That's why rotation is critical.
Rotating different chemical classes.
Yes, rotating between different modes of action. And just as importantly, integrating all those non-chemical methods, sanitation, biologicals, physical controls, reduces the selection pressure for resistance to develop in the first place.
You made a distinction earlier between obligate and facultative parasites.
Yeah.
How does that influence the IPM strategy?
It's absolutely central. Understanding the pest's lifestyle is key to effective control. Obligate parasites like lice and mange mites spend their entire lives on the host animal.
Right, the homebodies.
Exactly. So for them, the control strategy needs to be primarily animal-centric. Treating the animals effectively, maybe multiple times, using quarantine. That's how you break the cycle and potentially achieve eradication.
And facultative parasites.
Like flies and mosquitoes. They spend most of their lives, often over 95% of their population, off the host in the environment as eggs, larvae, or pupa.
So treating just the animals won't work well.
It helps reduce the biting adults, but it doesn't touch the vast majority of the population developing in the manure or standing water. For them, you need an environment-centric approach. Sanitation, manure management, eliminating breeding sites, that's where you get the biggest impact. You have to attack the problem where it originates.
Okay, that makes sense. But what if, despite the best IPM plan, things still go wrong? What's the process for diagnosis and treatment when you have an active infestation?
Well, accurate diagnosis is always step one. It starts with a good clinical examination, observing the pigs, looking for signs like intense scratching, rubbing, hair loss, and the specific types of skin lesions we talked about.
And for something like mange, where the mites are microscopic?
You need confirmation. That usually involves taking skin scrapings. And because Sarcops mites burrow deep, you need deep scrapings, ideally from the edges of active lesions. You might need multiple samples from several affected pigs because the mites can be surprisingly hard to find, even in infested herds.
Are there other diagnostic tools? Blood tests?
Yes, for sarcoptic mange, there are serological assays, blood tests like ELISA. These detect antibodies the pig produces against the mites. They're really valuable for monitoring mange levels at the herd level, checking if your control program is working, or confirming if you've successfully eradicated it.
And you mentioned slaughter checks before.
Right, slaughter checks remain a really practical and objective way to monitor mange prevalence. You examine the skin of carcasses at the processing plant. It gives you a good picture of the herd's status and helps correlate mange levels with those hidden economic losses.
Okay, so once you have a diagnosis, what about treatment? For mange and lice specifically?
As we mentioned, the macrocyclic lactones, ivermectin, doramectin are generally the go-to, the gold standard. They're effective and can be given by injection or sometimes in feed, which makes treating whole groups easier.
And that repeat treatment, 10, 14 days later, is often needed.
Yes,
Yeah.
absolutely crucial for breaking the life cycle, especially for mange. Most products kill the mites, but not the eggs buried in the skin. The second dose gets the ones that hatch out after the first treatment before they can lay new eggs. You must follow the product label directions precisely, including dosages and, very importantly, pre-slaughter withdrawal periods.
Withdrawal periods to avoid residues in the meat.
Exactly. Failing to observe withdrawal times can lead to illegal drug residues in pork, which has serious consequences for food safety and market access.
Can you actually get rid of mange completely from a herd? Eradicate it?
Yes, for sarcoptic mange, herd-level eradication is not only feasible, but often highly cost-effective in the long run. It takes a coordinated effort, though.
What does an eradication protocol look like?
Typically, it involves treating every single pig in the herd simultaneously, usually twice with an ivermectin product, 10 to 14 days apart. You pay special attention to treating sows just before they move into clean, disinfected farrowing houses. Thorough cleaning and disinfection of facilities might also be part of it. And then, crucially, maintaining strict biosecurity for any new animals coming in after eradication to prevent reintroduction.
It sounds like a big undertaking, but worth it.
Definitely. Think of it as a capital investment. You have the upfront cost and effort of the eradication program, but the return comes quickly through improved growth, better feed efficiency, reduced treatment costs going forward, and improved animal welfare. It stops those chronic, silent losses.
Okay. What about managing those really severe reactions like fly strike, myitis? You said that's an emergency.
It is. Immediate veterinary intervention is needed. The first steps are to carefully clip the hair around the wound, then gently clean and flush the area lavage using a mild antiseptic solution, like dilute chlorhexidine or povidone iodine.
And the maggots.
You have to physically remove all visible maggots. This is often done carefully with forceps. It can be time-consuming and, frankly, unpleasant, but it's essential.
Are there drugs to kill the maggots?
Yes. After manual removal, you typically use a parasiticide to kill any remaining larvae. Systemic ivermectin given by injection can work, or sometimes veterinarians might apply diluted ivermectin directly into the wound. But you have to be careful not to use harsh chemicals like alcohol or hydrogen peroxide in the wound, as they can damage the healthy tissue and delay healing.
And what about infection?
Because secondary bacterial infection is almost guaranteed with myitis, systemic antibiotics are usually necessary, often broad-spectrum ones initially. Topical antibiotic creams or ointments might also be applied to the wound.
Does the pig need any other support?
Often, yes. Severely affected pigs can be quite sick, potentially dehydrated or in shock. So supportive care like intravenous or subcutaneous fluids, electrolytes, and nonsteroidal anti-inflammatory drugs, NSAIDs, for pain and inflammation control are really important parts of the treatment plan.
Okay, that covers a lot of ground. So to wrap this up, the impact of these insect and arthropod pests on pigs is, well, it's huge.
It really is. It's multifaceted. You've got the direct irritation, the skin damage, the stress, then the significant economic losses through reduced production efficiency. And on top of all that, their critical role as vectors for some truly devastating diseases like ASF and JEV.
And the key takeaway for managing this seems to be moving beyond just reacting with chemicals.
Absolutely. The way forward is a robust, proactive, integrated pest management program. It has to be tailored to the specific farm, the specific challenges, but it's about integrating all the tools, sanitation, physical barriers, biological controls, and strategic chemical use into a holistic, sustainable system.
It sounds like a fundamental shift in approach is needed sometimes.
I think so. And maybe here's a final thought for you to chew on. Consider the difference between simply controlling pests versus aiming for eradication where feasible. Take sarcoptic mange, for example.
We talked about eradication being possible.
Right. Shifting the mindset from just keeping mange levels low to actually eliminating mange from the herd fundamentally changes the financial picture. You move from constantly spending money to manage these chronic, often hidden losses to making an investment that secures significant long-term gains in profitability and animal welfare. Sometimes, as we've seen, it's those subtle, unseen costs that end up being the most significant drain.